Nigeria has a large adolescent and youth population, with more than 1 in 2 people under the age of 24 and 41% of women of reproductive age within the 15 to 24-year age group. Postpartum women have the highest unmet need for family planning in Nigeria, with only 6% using any modern contraception 6 months after delivery. Supporting the state governments through their ministries of health, the community-focused approach for post-pregnancy family planning services, PoPCare, a 4-year project, was funded by the Bill and Melinda Gates Foundation, implemented by Clinton Health Access Initiative in partnership with the Center for Communication and Social Impact and Tulane University. The aim of the PoPCare project was to increase the uptake of post-pregnancy family planning services among young first-time parents in high-home delivery settings in Lagos, Nasarawa, and Rivers State of Nigeria. The PoPCare project was implemented in a total of 11 selected local government areas and used a community-focused approach to increase the uptake of family planning services and reduce unintended pregnancies and unsafe abortions. In Nasarawa State, these were Lafia, Nasarawa, and Nasarawa Eggon. In Lagos State, Amuwo Dofin, Ibejuleki, Ikorodu, and Lagos Mainland. And in Rivers State, Akukutoro, Asaritoro, Degema, and Ogobolo. Across the 3 PoPCare states, family planning demand generation activities were conducted by community volunteers. These community volunteers served as foot soldiers, referring young first-time mothers aged between 15 and 24 years old and women of reproductive age to PoPCare-supported facilities. At the facilities, trained service providers counseled and provided them with appropriate family planning information to make an informed choice for a family planning method that best suits them. The PoPCare project also trained traditional birth attendants, TBAs, in Lagos and Nasarawa states, and community reproductive health influencers in Rivers State, who also referred young first-time mothers aged between 15 and 24 years and women of reproductive age to make informed decisions and take up an appropriate family planning method from PoPCare-supported facilities. The project carried out interventions in the local government areas through the state government's leadership while leveraging on community structures to provide family planning information and services. Through a human-centered and participatory approach, highly visual appealing and emotive social and behavioral change communication materials were produced in 4 languages: English, Pidgin, Yoruba, and Hausa. Nasarawa State, popularly known as the home of solid minerals, is one of the neighboring states to the Federal Capital Territory, situated in the north-central region of Nigeria. Young first-time mothers, amongst other stakeholders who benefited from the services provided by PoPCare-trained social mobilization team and healthcare workers, shared their experiences and the impact the project had.
Yes, the intervention has helped in facilitating decision-making by the government in that aspect of reduction in child mortality. Since we've seen that when this is being put in place, the strategies now is going to reduce the mortality rate in the state. So we now agree with the intervention that we are going to work with them. And then there is this other approach again that has to do with peer-led mentoring, which they introduce in the facility they are working. Here now, the skilled one, those ones that the provider that we are trained, we are now training others that they will be working together with. In that case, it tends to increase more of these service providers that will provide quality healthcare services.
As social mobilization officer, my experience with PoPCare activity here really is when the PoPCare doing community engagement where sometimes I follow them to the communities, where we see a group of men discussing with them. They tell them about the importance of breast spacing, giving them health information about the importance of breast spacing. It's a very wonderful job, really, and we have seen changes with their coming, with the PoPCare activities. We have seen changes, really. Before now, the government used to supply these family planning commodities, and it will be lying down at the facility. People are not accessing the facility to receive the services. You will see the commodities expiring. Soon they will be drawn out because they expired. But now, with the coming of this PoPCare, in fact, we are even almost out of stock all the time.
Abin da ya sa na fara amfani da tazarar haihuwa saboda ni karan kaina ina neman lafiya da ci gaban rayuwata. Saboda a zaman da muke cikin nan ma na zauna na yi tunani idan har ban yi wannan abin ba. Dan a gaskiya wasu mata suna kuka da sakaci, ka irin sakaci da suka yi da rashin wannan planning din. So mata suna kuka akan shi sosai daga baya don saboda ni ma mijina shi ya bani goyon baya 100% da na kawo mai shawara akan cewa mu yi shi. Saboda shi ma yana ganin haka zai taimaka min, ya taimaka ma lafiyan abin da nake da shi da kuma shi karan kanshi mai gidana da ni ma karan kaina lafiya na.
Abin da ya sa na fara tazaran haihuwa saboda mu inganta rayuwar 'ya'yanmu. Bayan shi mijina ya so mu yi tazaran haihuwa ɗin, so yanda wasu na faɗa suna tsoratar da mu akan yana sa rashin lafiya da zuban jini da sauransu. Madam Baratu ta zo ta same mu akan ga hanyoyi da ake bi ake samun tazaran haihuwa, sai na samu mijina na mishi magana akan akwai hanyoyi da yawa da za ka samu tazaran haihuwa. To shine sai muka zo wajenta ta faɗa mana, muka samu muka je asibiti muka fara injection method.
What influenced my decision to take a family planning method are many. Number one, my husband. Number two, my job. And then number three, my family member, most especially my father-in-law. What encouraged me to continue using modern family method is that once in a while, we used to have all these ladies chats, some we said, since I've been doing this family planning, no child, but once I'm ready to take in, I just go, they will remove it, the pregnancy will come, and I said, this is a good one for me, due to the nature of my job, let me also go for this thing. So I started the first month. After 3 months, I saw that it worked for me, quite sure. Even though I was having some side effects, but it worked for me. I achieved my goal. I say, since this worked for me, and there was no much difference from what other ladies were saying, that once you go for family planning, you increase in size, all these things, I was not experiencing all that. So I was encouraged to continue the family planning.
Okay. The emergency transport services, it's also a good one because it has reduced the mortality rate in the community, because I have their numbers. Once I have a case, we'll call on the drivers at any time, and you see the road. The road is not more terrible, and in the night it's very dangerous. But them, they are ready at any time when you call them. They are ready to go. So almost everybody in the facility is partaking in every aspect of the work. Unlike before that, it's a particular group of people that were trained that will work for a certain service. But now with PoPCare program, almost all of us can do almost everything in the facility.
My experience as a community volunteer on this project
First of all, we have series of activity as a community volunteer. We have the door-to-door activity, we have the voluntary mobilization, we have compound meeting.
Initially, the number of women that used to turn up for family planning is only few, but now they can have so many women. Apart from that, men also in the community, before the coming of this PoPCare project, so many of them, there are so many stories going around in the community that makes them not to accept these modern contraceptives. But with the achievement of this PoPCare project, we do help educate them, and so many men now, they are the ones taking their wives to the health facility.
There were so many training on our health workers, including that of community volunteers, which they really increased the demand of the health facilities activities. The FP tracker has really helped me as a reproductive health supervisor in the LG.
The door-to-door mobilization is when we come to the community like this, we first of all visit the chief of that community to tell him our mission of being in that community and who we are, which after then we move into the community, we do house mapping. Choose those houses that are having young first-time mother, we select them and number them. Then the next day when we come, we now start going into those young first-time mothers' house, we mobilize them, we encourage them, we tell them about the family planning method, and we make sure that they go. Because after sometimes, when we give them the referral card, they collect it and they went. After 2 to 3 days, we still follow up to make sure that they have went for the family planning methods. Even I personally, I use the method of family planning and I enjoy it very well because it helped me to space my children the way I want it, and even my house. We are living happily.
The traditional bed attendants, they go around house to house in the community. They tell people about the importance of the services, family planning services. Not even only family planning services, tell you about the antenatal care services, the postnatal care services, the care of the newborn, and then they should even come to the facility for delivery. They also help in identifying the danger signs that are associated to pregnancy and also the baby. Aside from doing that, they do come with them to the facility when they see that they feel those client or patient might not come to the facility. So they do come with them to the facility. They also, that's the traditional bed attendants. They also ensure that those clients have a very good services.
We thank God for PoPCare because PoPCare imparts value in our life. Because before the coming of the PoPCare, we used to deliver, the women used to deliver at home with us. We don't used to advise women to come to the hospital for anything. We just advise them to come to us with the TBA at home. In any circumstance, we can handle it at home. That is what we think that time. But when PoPCare come and they teach us something, what they teach us, they impact knowledge in our life, because we tell the women that coming to the hospital is very safe to them, to deliver in hospital and to come for antenatal in the hospital, to come to immunization of children in hospital. So PoPCare imparts knowledge enough in our life because of that thing. Because it's very safe for a woman to deliver in hospital than at home. If a woman delivers at home with us, that time we don't have hand glove to wear to receive the baby. But when they are coming to the hospital, the doctor or nursing have everything that will take care of them and the babies at the hospital. So we thank God for PoPCare they impart very much knowledge to us and the community at large.
A community volunteer recognition event took place in Lagos, Nasarawa, and Rivers State, and the best performing community volunteers across the 11 local government areas were identified and given awards. All the community volunteers received certificates of appreciation.